This is the second part of the series we have on the MRI appearance of arachnoiditis. If you haven't looked at the first part already, please go back to that. That covers the normal appearance of nerve roots on MRI and also the pathogenesis of arachnoiditis. It's important to know that before you continue. So this video in part 2, what we're going to look at is the normal areas where we get contrast enhancement and where we don't get contrast enhancement, particularly in the lumbar spine. This is important because with arachnoiditis, often we are giving contrast. You need to know what normally enhances and what doesn't usually enhance before we can interpret those studies. So today we're going to go into the second part of the series where we're going to look at the appearance of contrast-enhanced MRI scans, what's normal enhancement, and which areas, which if they are enhancing, are abnormal. The other thing that we need to know before we get into abnormals, what is normal enhancement? Because obviously with radiculitis, with inflammatory change, you can get enhancement, but we need to know beforehand what's normal and what's not normal. So when you give contrast, there are regions within the spinal canal which will enhance, and also outside the canal. So there's a venous plexus that's present. There's a dorsal nerve root ganglion. So if we look at this, posterior venous plexus is within the vertebral body. You can also see it, you'll see veins in the epidural fat. So this is a normal appearance to get this sort of triangular central area of enhancement within the vertebral bodies. Also normal to get epidural enhancement, particularly anteriorly. It tends to be a bit more prominent anteriorly than it is posteriorly, but this is a normal appearance. Dorsal nerve root ganglion, normal to get enhancement of this. This is outside the thecal sac within the foramen, and within the epidural fat, the fat itself should not be enhancing. So here we've got a T1. This is a post-contrast T1 fat set. You can see that it basically just fat saturates out. So what we have is that within the epidural space, we have these veins that will enhance both anteriorly and posteriorly, but the bulk of the epidural space should not enhance. What about within the canal itself? So there's normal venous plexus that lies both anterior and posteriorly. These will be over the conus and in the proximal cervical region. They're not seen on the thoracic cord. So what you're looking for is this sort of squiggly line. They're not straight lines. There's no nodularity to it. So that comes in when you're trying to differentiate it from metastatic disease. This is a common area to see these venous plexuses, both anterior and posteriorly, overlying the conus, distal thoracic cord, and within the cervical spine, particularly proximally. Okay, so what else can enhance? So this is a post-contrast scan of the lumbar region. This is a T1 fat set. We've got nerve roots in here, but we can't see them. And that's correct because they should not be enhancing. As we said that they are avascular, so the arachnoid pia is avascular, it shouldn't enhance. You can get this median vein. There's a single vein which comes up to the conus, and you can follow it. So you can basically, if you see a single area of enhancement, it's usually in the midline, you should be able to follow that back up to the conus. So that you can see enhancing. So don't confuse that for radicular enhancement, for nerve root enhancement. Nerve roots, you really should not be seeing any enhancement normally at all. To see more of these educational posts, we have a WhatsApp community channel which you can join. And at the moment, we also have 10 specific courses on joints and spine that you can learn in much more detail. And if you just want to continue seeing more of these videos, you can also subscribe to our YouTube channel.